Locked-in syndrome and Rett syndrome are two distinct neurological conditions with several key differences. 1. Cause: locked-in syndrome, typically caused by damage to the brainstem, often due to stroke, traumatic brain injury, or diseases affecting the brainstem. Rett syndrome, genetic disorder caused by mutations in the MESP2 gene, almost exclusively affecting females. 2. Onset: locked-in syndrome, often sudden, following an acute event such as stroke. Rett syndrome usually manifests between 6 months and 18 months of age, following a period of apparently normal development. Motor function: locked-in syndrome, severe motor impairment, often resulting in almost complete paralysis of voluntary muscles, except for eye movements. Rett syndrome, progressive loss of motor skills, including purposeful hand use, leading to significant motor impairment. 4. Communication: locked-in syndrome. Individuals are typically fully conscious and aware, but unable to speak or move other than eye movements or blinking, limiting communication. Rett syndrome: communication impairments due to loss of speech and hand function, but eye-gaze communication methods may be used. 5. Cognitive function: locked-in syndrome. Generally intact cognitive abilities and awareness despite severe physical limitations. Rett syndrome, variable cognitive impairments, including intellectual disability, with some individuals having preserved cognitive abilities. 6. Gender prevalence: locked-in syndrome, no gender predilection, can affect both males and females. Rett syndrome almost exclusively affects females due to the genetic mutation pattern. 7. Progression: locked-in syndrome, generally stable once the acute phase stabilizes. Improvements in communication methods and quality of life can occur with support. Rett syndrome, progressive condition with loss of skills and function over time, though the rate of progression can vary. 8. Genetic basis: locked-in syndrome, not a genetic disorder, primarily caused by physical damage to the brainstem. Rett syndrome, genetic disorder with a known mutation in the MECP2 gene. 9. Life expectancy: locked-in syndrome, variable depending on the underlying cause and associated complications, e.g., infections, respiratory issues. Rett syndrome, reduced life expectancy compared to the general population, primarily due to complications such as respiratory problems. 10. Therapeutic approaches: locked-in syndrome, rehabilitation focuses on maximizing quality of life and communication options, often involving assistive technologies. Rett syndrome, supportive care with therapies addressing motor and cognitive impairments, along with management of associated medical complications. 11. Clinical features: locked-in syndrome. Primary feature is paralysis of voluntary muscles, sparing vertical eye movements and blinking. Rett syndrome features include loss of purposeful hand skills, repetitive hand movements, and characteristic breathing abnormalities. 12. Diagnostic criteria: locked-in syndrome. Diagnosis based on clinical signs and symptoms, often confirmed by imaging studies showing brainstem damage. Rett syndrome. Diagnosis based on clinical criteria including regression of motor skills, characteristic hand movements, and genetic testing for MECP2 mutations. 13. Neurological basis: locked-in syndrome involves damage to brainstem nuclei crucial for motor control and communication. Rett syndrome: mutation affects neuronal development and function, leading to widespread neurological effects. 14. Prevalence: locked-in syndrome, relatively rare condition. Rett syndrome, rare genetic disorder, but more common than locked-in syndrome. 15. Research and treatment focus: locked-in syndrome focus on rehabilitation strategies and technological aids for communication. Research includes genetic therapies and supportive care interventions aimed at improving quality of life and addressing medical complications. These differences highlight the distinct nature of locked-in syndrome and Rett syndrome in terms of etiology, clinical presentation, and management approaches. Thank you. Have a nice day.